So I shall be talking about the high blood pressure is a silent killer, what we can do to control it, and how can it really destroy us or damage us. That's why it is called silent killer. It's understanding and prevention of high blood pressure we shall be talking today. As you all know that this month is dedicated to the hypertension, as World Hypertension Day falls on the 17th of this month, 17th May. So that's why we are really working for the hypertension throughout this month. And this week is the hypertension week, and this month is called as hypertension month. So it is important to make the people alert about their about knowing their numbers, about making the physical activity more aggressively followed, and at the same time they should also look for cutting the salt in their food. These are the three primary things which everybody should follow in his life. Now, to start with, what is blood pressure? Blood pressure is the force of blood pushing on the walls of the blood vessels while the blood is flowing through the wall. So, high blood pressure is that which is also known as hypertension. It means that your blood pressure is too high whenever it is flowing in the wall or when it is flowing in the wall. Throughout the life, your blood pressure keeps on flowing in the walls, in the vascular compartment. And once it is flowing with the high pressure, it is called hypertension. So if we look for the difference between the normal blood pressure and high blood pressure, it's very nicely been explained on this slide where you can see the high blood pressure blood vessels is narrowed because of multiple reasons. What could be the multiple reasons? That some depositions may occur at the internal surface of vascular wall, and that leads to the narrowing of the vascular wall. And once this narrowing is not there, the blood pressure is normal, what it should be when the blood pressure, once the vascular wall narrowing is not happened. And once this narrowing is there, then blood pressure is increased. Untreated high blood pressure can cause blood vessels to narrow, which may lead to other serious health problems. Or I think I should say that narrowing of the blood pressure, narrowing of the vascular tree or vascular lumen is causing the hypertension or high blood pressure. 120 millimeter of systolic blood pressure means the pressure exerted when blood is ejected into the arteries. Normally it is 120 mm of mercury. Diastolic blood pressure is that blood pressure which is exerted within the arteries between two heartbeats, and it is normally 80 mm of mercury. So high blood pressure is the danger sign once it is crossing 130 mm of mercury at systolic and diastolic 80 mm of mercury. The blood pressure which is just behind this cutoff line, ranging between 120 to 129, is supposed to be elevated blood pressure, and diastolic blood pressure less than 80 but not cross the 80 is supposed to be the elevated blood pressure. So once the systolic blood pressure is ranging between 120 to 129 together with 80 or nearby less than 80 diastolic blood pressure, we call it elevated blood pressure. And it's well known to all of us. If the blood pressure is less than 120 and less than 80 diastolic, it is called as normal blood pressure. It is important to know our number for all of us, for every one of us, which is normally remains less than 120 systolic and less than 80 diastolic. It is called normal if it is both the times it is being achieved. If it is ranging between 120 to 129 and less than 80, it is called elevated. High blood pressure is more than that, anything. But if it is 140 or more than that systolic, or 90 or more than that systolic, it is called stage 2 hypertension. And crisis occurs once it is crossing the 180 at systolic and 120 at diastolic. If we look for the prevalence, Globally, only one of every seven people has their hypertension under control. Means out of the seven people, six people are keeping their blood pressure uncontrolled. And 50% of them, those who are uncontrolled, does not know that they are running with high blood pressure. Rest of the people, if we talk about remaining 50%, out of those 50% are those who are knowing that their blood pressure is high, but they are not being able to take the treatment. Now we have left with remaining 50% or the people, those who are knowing that their blood pressure is high, only 50% of them are taking the treatment and half of them are controlled and remaining half of them are not controlled despite taking the treatment. One in three Indians has high blood pressure. Anyone, those who are having the high blood pressure are can be of any age, maybe the children, although blood pressure is high because of the stiffening of the artery. So normally it takes place with the advancing age. So we can find more hypertension among the elderly people and older people. But in certain situations, it could be in the children's also. Certain endocrine reasons may be there, certain kidney reasons may be there. 23.1% men and 22.6% women above the 25 years suffer from hypertension. So we can understand it very well. This is the silent killer because more than 30% of the people of the total those who are having the high blood pressure are not even knowing that they are having this. And most of the time, there are very minor symptoms or no symptoms at all. Initially, there are the symptoms once a person starts developing the high blood pressure, but once it is being ignored by the patient repeatedly, then they stops having, and many of the time patient gets accustomed of those symptoms, then he did not take them inappropriate or abnormal. So whenever we talk about the prevalence of hypertension in India, especially our more of the data comes from the urban population. But it is more important to know about the rural population. Many of the time, this remains in the mindset of many of us that rural population is not having the hypertension because they do not have the stressful life, they do not have high salt diet, they do not have the physical inactivity, means they are having a lot of physical activities. And because of all these reasons, it is not, they are not prone to have the hypertension, but this myth is there. And because of what we do not know and we have not done appropriate prevalence studies in the rural population, so many of us do not understand it and do not believe it. But actually, the wide difference between the rural and urban population as far as the hypertension is concerned is getting narrowed down as the time is being passed. And this is happening because of the fast urbanization of the villages and rural India. The prevalence of hypertension was found to be 17%, which was observed to be higher among females, 18.3% individuals than males, which were 15.8% individuals. The prevalence of hypertension was observed to be higher among the older people, as I already explained in the previous slide. It was found to be 5.26 times higher in elderly people, those are more than 50 years of the age, than the younger people, those who are having the 30 years, less than 30 years of their age. We found pre-hypertension in 65.74%, stage 1 hypertension in 11.33%, and stage 2 hypertension in 5.69% individuals. Now, there is another study in which 25 years trends in hypertension prevalence, awareness, treatment, and control in an Indian urban population has been seen in the Jaipur Heart Watch study. More than half of Indians with this medical condition, which is called a hypertension, are not even aware of it. Hypertension screening, awareness, treatment, and control in India, which is a nationally representative cross-sectional study among individuals aged 15 to 49 years, has shown the evidence on where in the hypertension care process individuals are lost to care. and how this varies among states and population groups in a country as large as India is essential for the design of targeted intervention and to monitor progress. Look for the risk factors of the hypertension. We can divide into the two broad categories. One is the modifiable and there is the non-modifiable. Non-modifiable are those which cannot be changed, like age, family history of hypertension, existing health condition. Family history of hypertension is deriving from the genetic inclination towards the hypertension. That's why these things cannot be changed. Existing health conditions mean a person is having the kidney disease, a person is having any other such kind of a disease where the narrowing of the blood vessels is the part of the disease. Then in those conditions, hypertension is a necessary phenomena to be occurred and it is not modifiable. Once we talk about the modifiable risk factors, means which can be changed, and by doing so, we can stop the high blood pressure, like smoking, diet, physical inactivity is the risk factor, and physical activity actually helps us in removing or reducing the blood pressure. Weight means more weight or weight gain is the modifiable risk factor, or we can say obesity is the modifiable risk factor. Alcohol ingestion, stress, they are the other modifiable risk factors which can be corrected from the human life. Worrisome factors are those. Out of the most worrisome fact of hypertension is that it can affect any age group. Thought to be the disease of the elderly or the obese, nowadays it is being more frequently diagnosed in the young. It affects any organ of the body, be it the brain, heart, or the kidney. Patient can complain of the headache, tiredness, anxiety, dizziness, weakness, confusion, nausea, chest pain, and even weakness in one side of the body. What is the outcome of the stroke kind of a condition? Very commonly seen in hypertension patients if it is not controlled. As I already said in previous slides, awareness status is very poor across the world and so in our country, India also. About 50% people, those who are having the high blood pressure, they don't know that they are having this disease. Indian adults are unaware they are ailing from hypertension. About 10.8% of the all deaths in India are due to hypertension and its complication because 50% people don't know about their hypertension and those who know about their hypertension, 50% of them do not take the treatment. So 75% people don't take the treatment. Only 25% people take the treatment, and out of which only 50% are capable enough to control their blood pressure. Consequences of the high blood pressure: stroke, loss of vision, heart failure, heart attack, sexual dysfunction, kidney disease, or kidney failure. So there is a lot you can do to control your blood pressure. How to diagnose of hypertension? We must ask about the history of the patient, like patient might have had any other disease which may lead to the hypertension. We can ask about the family history of hypertension. We can ask about the food habits in the family so that we can also about the other habits which may lead to the hypertension like smoking, alcohol. And then we can also do the physical examination to find out those diseases and signs and symptoms which are not being told by the patient or which has not been appreciated by the patient. What could be those? Like if the patient is having any coarctation of the aorta, the patient is having any other such ailment which may be having in that patient since from the childhood or from the birth, then those can only be detected by the physical examination. And most important thing in the physical examination is measuring the blood pressure. And once you measure the blood pressure, it is very much important to measure the pulse rate and look for the pulse rate and examine it properly so that we can understand well how it is being done or how is it being have by the patient in setting of the hypertension. Because many times many causes of hypertension are predicted by the pulse of the patient. Renal function like serum creatinine, urine creatinine clearance, they all are very much important because in renal dysfunction or in renal failure, patient may have the hypertension. Electrolyte, especially the potassium. If the potassium is low, patient may develop the hypertension. If the sodium is high, it becomes the reason of hypertension. Diabetic patients are also having the hypertension. That's the blood glucose is important to measure. Apart from that, ECG, which tells about the impact of the hypertension on the heart, as well as lipids, which also tells the status of atherosclerosis, which is very important reason of arterial narrowing in many human beings. Ambulatory BP monitoring is the gold standard for the hypertension diagnosis and monitoring so that a person can be diagnosed not only whether he is having the hypertension but also its a circadian rhythm of hypertension, and we can also know that what is the right time to give the medication to the patient. So once we are doing the physical examination, it is very much important to do the BP measurement. It can be done into the three methods. One is the clinic or office BP measurement, and there is the home blood pressure measurement, and ambulatory blood pressure measurement is the gold standard because it gives the correct idea about the round the clock high blood pressure or hypertension status of the individual. Whenever we are doing the home blood pressure monitoring or self measurement of the blood pressure, self measurement of the blood pressure involves the use of blood pressure monitor to measure blood pressure when the person who is going to measure blood pressure is away from a doctor's office or hospital, usually at home. And nowadays, it has been a trend as well as it has been recommended by multiple guidelines that patients should be diagnosed out of the doctor's office blood pressure measurement, not in the office blood pressure measurement. Prepare for your blood pressure reading. You should avoid exercising 30 minutes before doing for the blood pressure measurement, not to be eating a meal at least for 30 minutes, no drinking coffee or tea or any caffeine intake for at least 30 minutes, or they should not have been done the smoking for last 30 minutes. If you are on blood pressure medication, measure your blood pressure before you take the medication of that particular time. Go to the bathroom and empty your bladder before measuring the blood pressure. Find a quiet space with a table and chair, no disorder, and there should not be any distraction. Sit and relax for 5 minutes before taking your blood pressure reading. Uncover your upper arm and put the blood pressure cuff above the elbow and midarm. Do not put the cuff over your clotting. Reset your arm on the table so it is supported and the blood pressure cuff around your upper arm is located at heart level. Keep your arm supported and your palms up. While taking your reading, make sure your feet are uncrossed and flat on the floor. Sit up straight in a chair. Make sure your back is supported. Stay calm and relax. Don't talk or watch TV while taking your reading. Measuring the blood pressure at home is simple and effective. Studies have shown that self measurement of the blood pressure, along with clinical support, can help people with hypertension lower their blood pressure. Take more than one measurement whenever you are measuring your own blood pressure. To make sure your results are the same, take 2 or 3 measurements 1 minute apart each time. Also, try taking your blood pressure the same time each day. Work out with the doctor for setting the blood pressure target that are healthy for you. Typically, a healthy blood pressure is less than 120/80 mm of mercury. If your reading is higher, talk with your doctor about how to lower or to control it. Record and track your measurement. If you may diagnosed with high blood pressure based on your medical history, your blood pressure readings are consistently high, then 130/80. Ask your doctor what your target number should be and how often to check it. Use the blood pressure tracker to record your number. What should be done as a first step for the blood pressure correction? One, we must take the healthy food, a diet which is low in sodium and low in saturated fat, like the DASH eating plan, should be the ideal for the blood pressure reduction. Move more means more of the physical activity. Get at least 2.5 hours of the physical activity a week to help lower and control blood pressure. That's just 30 minutes a day, 5 days a week. For if we go into the details of the healthy eating, we must add at least 5 servings of the fruits of 100 gram each time in a day. If you get fast food, ask for a salad instead of fries. Give meatless Monday as a try and commit to one salt-free day a week. Use herbs for the flavor instead. Once we are going for the more of the physical activity, it is important to do it regularly. And what can be more encouraging while doing the physical activity, invite a colleague for regular walks or on exercise classes, give the elevator a day off and take the stairs, take a break to play outside with your kids, march in place during commercial breaks while watching television with your family. Smoking is the biggest killer for the hypertension, so it is important to stop smoking. The chemicals in tobacco smoke can harm your heart and blood vessels. Quitting is difficult, but many times people have done it and you can also do. Taking the first step towards a healthy blood pressure. The third thing in that series should be weight reduction. Aim for a healthy weight. Just to 3 to 5% of your losing weight can improve your blood pressure. If you weigh 200 pounds, that a weight loss of 6 to 10 pounds is needed. Join a weight loss program with some weight loss centers or with your help of your friend. Sign social support agreements with 3 family members or friends. Manage stress. That is another important part of the blood pressure management. Stress can contribute to high blood pressure and other heart risk. If it goes on for a long time, it can make your body store more fat. Practice mindful meditation for 10 minutes a day. Share a funny video, joke, or inspirational quote with a friend. Talk with your doctor if you have trouble managing stress on your own. Healthy diet and physical activity can reduce a substantial burden of coronary heart disease, hypertension, up to 80% of type 2 diabetes, and significant proportion of the premature death. What is healthy meal or healthy food? A healthy meal includes generous amounts of the vegetable, adequate whole grain, pulses or beans, along with modest portion of the nuts or seeds, complementary by selection of fruits and plain fermented yogurt or curd. It is free of added sugar or contains very minimal amounts and is seasoned with minimal oil or fat and salt for taste. What can make a healthy snack? An ideal healthy snack consists of the vegetable or fruit salad adorned with a seed or nuts topped with yogurt. Additionally, a roasted or boiled beans, lobia, chickpeas, and peanuts can serve as a nutritious snack option. ICMR National Institute of the Nutrition's dietary guidelines in 2024 suggest about the balanced diet. What is the balanced diet? Balanced diet fulfills all nutritional needs of the body. No single food can provide all the necessary nutrients. These need to be obtained through judicious use of a variety of foods. Appropriate dietary habits includes promote optional growth and development, prevent malnutrition in its all form and undernutrition, micronutrient deficiencies, overweight and obesity, and diet-related non-communicable disease. A balanced diet should provide not more than 45% calories from cereals and millet and up to 15% of calories from pulses, beans, and meat. Rest of the calories should come from nuts, vegetables, fruits, and milk. If we look for the high blood pressure diet chart, it should be having like this at 9 a.m. We should have a breakfast in which we should have handsome amount of the carbohydrate, followed by 11 a.m. should be taken fruit, not more than 100 gram. 1 p.m. is the lunch time where we can take one non-vegetarian dish also. 4 p.m. is the time of sprouted with tea or preferably the tea should be green tea and then 8 p.m. should be the time for the dinner and we should ensure that it should be rich in leafy vegetables or green vegetables. The total fat of the high blood pressure patient should not be more than 15 gram in a day. Calcium must be at least 500 milligram. Sodium should not be more than 1 gram, 272-gram carbohydrate and 40 gram in protein and 17-gram iron is recommended in patient daily total calories which are coming from the food. What is the role of diet in high blood pressure? Sodium intake reduction, potassium enriched food inclusion, magnesium and its inclusion in the food matters, so that magnesium enriched food should be promoted in hypertension individuals. Dash diet means which is rich in the fruits, so that more of the potassium can be received by the patient. Balanced meal plan consisting of the fruits and vegetables with lean protein and low fat dietary component that aid in maintaining healthy blood pressure levels. Cutting down on the sugar intake. Reducing sugary drinks, processed snacks, and sweets from your diet effectively prevents hypertension and ensures healthy living. There are certain foods which should be avoided with high blood pressure, like high sodium intake food or 1 teaspoon of the salt should not be more than this. Limit your caffeine intake. Alcohol intake can substantially increase the risk of high blood pressure, so better to be avoided. Processed food often contains added salt and unhealthy fat that increase the risk of hypertension. Many a time, the processed food may be having salt as a preservative also. So that's why it is a reason for hypertension at many times. Importance of the balanced diet during different life stages. Like in elderly, where the risk of hypertension is much higher because of the stiffening of the vascular wall. So it is important that balanced diet is should be there for being physically active and healthy. The only we should try to eat which is enough to keep us physically active and healthy instead of taking any food which we may like in excess of amount. Adults, for maintaining health, productivity, and prevention of the diet related disease. Once you are in reproductive age, we should take the food to meet the extra nutritional needs for childbearing and rearing phenomena of the life. Adolescents, once you are in 10 to 19 years of the age, it's time for the growth spurt. So maturation and bone development also takes place in these years of the life. So we should be careful for taking the food in that perspective. If we are talking about the children, 2 to 6 years of the age, they need food for the growth and development as well as ensuring and developing the cognition in their activities. And for that reason, the food should be enough and rich with the enough minerals and vitamins so that it may not be having any deficiency in the childhood or which may hinder the growth development of the child. Infants and young children, means those who are ranging between the age 6 months to 2 years, for growth development and cognition, breast milk and nutrition rich complementary foods is important for the same. 0 to 6 months, once the growth and development is requiring the food intake, where it is important to take the maximum contribution from the breastfeeding. High calorie food should be swapped with the healthier food. Means once you are supposed to eat high calories and containing highly refined ingredients, it should be replaced with a low caloric salad and sprouts from whole grains and vegetables rich in nutrients. Deep fried snacks like samosa, etc., have the high level of the cooking oil and fat. They should be replaced with the nuts and seeds, healthy fat integrated in food. Food containing high in refined ingredients, high fat, and high sugar. Traditional sweets and snacks made with the whole grain, nuts, millets, and oil seeds having relatively lower fat and sugar. So again, once we are going to take the drinks which are rich in the sugar, sugar sweetened carbohydrate, sugar sweetened carbonated, non-calorinated, non-carbonated beverages, health drinks and energy drinks should be replaced with the neutral foods like tender coconut water, buttermilk, fresh lemon juice, chia seeds soaked in lemon juice. Fresh fruit juices should be replaced with the whole fruits. Jam, sauces, and dips should be replaced with the fresh homemade chutneys and dips, which are being made by the help of the coconut, etc. Avoid carbonated beverages and fruit juices with added sugar, like cola drinks, drinks which are carbonated drinks, and mixed fruit juice, which are packed food, are full of the preservatives, which are mostly the sodium salt. So they should be replaced with tender coconut water, buttermilk, fresh lemon juice, and chia seeds soaked in lemon juice. Orange juice, watermelon juice, fresh mango juice, pineapple juice, pomegranate juice, apple juice can be taken, but if they are coming as a packed food or packed juice, it should be avoided. Whole fruits are preferable as they contain fibers and their nutrients. Freshly made juices for one normal individual should be from not more than 100 to 150 gram of the fruits. 7 ways to lower the blood pressure. Watch your diet. Get moving or physical activity must be ensured. Avoid smoking. Reduce the stress level. Manage the weight or weight reduction should be encouraged. Get rid of the obesity. Reduce alcohol consumption and take your medications in time. Medications for the high blood pressure. Classes and their effect. So multiple varieties of the medications are given for control of the high blood pressure. The most recommended one is the RAS blocker. RAS blockers are also having the two groups of the medication. One is the ACE inhibitors and other is the ARB. Angiotensin converting enzyme inhibitors or ACE inhibitors reduce the body's production of a chemical that causes the arteries to narrow. On the other hand, angiotensin 2 receptor blockers help keep blood vessels open. Beta blockers reduce the heart rate, so their heart is not working as hard. Calcium channel blockers prevent calcium from going into the muscle cells of the heart and arteries. Diuretics help eliminating the extra salt and water. Treating high blood pressure can lower your risk of high life-threatening conditions, keep you out of the hospital, help you live longer. Ways to manage high blood pressure: take prescribed medicine, monitor your blood pressure, increase physical activity, eat a healthy diet. Thank you very much for your kind listening. Now, the age bar, which was earlier at the 50 or more, has been reduced to all age group of the individual. Earlier, it was thought the stiffening of the arteries, which is the main reason for the blood pressure increase, used to happen once a person crosses the 50 years of the age. And hypertension was supposed to be a phenomena of the aging. But now, in present scenario, once we are having so many changes in our life from 18 years onward, many of our youngsters start taking the alcohol, smoking. Many of them keep themselves awake for a long night, as well as they also keep on working on screen for various reasons. Many of them also celebrate for a late night parties, and all these things once are being done very frequently, they are becoming the reason of stiffening of the arteries much earlier than it is supposed to be happening with the age. The same time, diabetes is also started occurring 2 decades earlier. Hypertension is also started occurring a bit of earlier. So in that setting, these two also makes the person more vulnerable for the stiffness of the arteries, and heart patient develops hypertension, and as a result of that many times heart problem or kidney problem also. So I suggest 18 years onward people should check their blood pressure regular basis, at least once in a year must be done. Yes. For how does it causes the sexual dysfunction? So multiple mechanism works at the same time. One is the basic mechanism of that is the endothelial dysfunction. Endothelial dysfunction starts much earlier than the hypertension sets in our body, because hypertension is the high blood pressure which gradually increases. Once your blood pressure is less than 120 and 80, you are very happy that you are normal, but it gradually one day goes up to 122, then it goes up to 124, then 130, and more than 140. Gradually, it goes up. And once this is happening, once your blood pressure is less than 120, endothelial dysfunction starts taking place. And in fact, this endothelial dysfunction takes your blood pressure to that level which is not really acceptable to you. So this endothelial dysfunction also starts working into the blood vessels which are giving the blood supply to our sexual organs, as well as the blood vessels which are giving the supply to our brain. So whenever the sexual dysfunction takes place, it is not only the sexual organ which is responsible for that. Our brain is also responsible for the sexual dysfunction. So many of the time you find a lot of patients of the sexual dysfunction in the clinics of the psychiatrists. Reason is that they are having the sexual dysfunction, and at the same time they are also having others related problems like anxiety, neurosis, psychiatrical diseases, for which they visit to the psychiatrist. Many a time this is related to the hypertension. And multiple times it is also seen that hypertension patients are diagnosed for the first time in the psychiatric clinic, in especially if they are in their early age. So this is the mechanism which is related to the stress, which is related to the narrowing of the arteries. That arteries may be of the brain, that arteries may be of the uh, sexual organs. At the same time, once they are not having the enough space and enough filling of the arteries, then obviously the sexual erection does not take place, and it leads to the sexual dysfunction. So it is multi-pronged and multifaceted mechanism which takes our patient towards the sexual dysfunction. As far as the why does it happen, I don't think it is very difficult to understand, because once there is a temperature is going to reduce, whenever there is a cold atmosphere, arterial vasoconstriction takes place. So whenever there is a atmosphere is having more cold, temperature is going down, in that case vasoconstriction takes place, and vasoconstriction leads to the hypertension. Because once the arteries are not remained dilated enough to supply the blood to or end organ, they gets more pressure to supply the blood so that they can maintain the blood supply whatever the need is there. So this makes the vasoconstriction. Cold makes the vasoconstriction, and vasoconstriction causes the hypertension. Once a person in winters develops the hypertension, it must be corrected. Not necessary. Medicine should always be the answer for that. If you can do is without medicine by lifestyle modifications, mean making the person more physically active, making the person more doing the exercise, making the person take keep himself eating, because it is caused by the cold atmosphere. If you are providing the enough heat, probably this will be correcting the hypertension. But if this is not enough to correct the hypertension, obviously we should not hesitate to take the medication. And it has also been seen few people may need medication up titration during the winters, which may need to down titrate or reducing the medication again when March and April starts. This can control the BP, and up to the larger extent this can help us if we start doing in the early days of the hypertension. If these are the reasons for development of the hypertension, then only correction of these items in the food, only including these items in the food would be sufficient to correct the hypertension. But it's not only one reason which is giving rise to the hypertension. Whenever the hypertension or high blood pressure is there, multiple reasons are responsible for that. And low low magnesium and low potassium are one of those reasons. So usually they are not the reasons, but once they are supplemented enough, they reduce the blood pressure. In pregnancy, most of the time we have seen the power of magnesium in eclampsia or pre-eclampsia conditions once a lady develops hypertension, which is very much detrimental. Magnesium is the remedy for that, and it helps. Magnesium sulfate helps in that condition, especially in routinely any state of the hypertension. If you ensure that patient's food is having enough amount of the fruits, and fruits are the very good source of the potassium, then it helps in reducing blood pressure. More important thing, you must have seen that the patient, those who are in the kidney failure, they have got their potassium level set at the high. They are having the hyperkalemia. In those settings, if you will reduce the potassium, then your patient would be getting relief from the symptoms of the kidney failure. In those conditions, we should not focus our potassium supplementation or potassium rich foods. This is the time when the potassium rich food should be cut down. So, whatever is the cause, whatever is the setting of the patient, whatever is the conditions which are giving rise to the hypertension, looking into that, blood pressure treatment should be done. It's not only the one point which should be targeted. We should look the patient in full of his disease profile, in full of his health profile. Whenever a person is having the hypertension in the old age, he should be treated. I'm not saying that he should always be started a treatment with the medications or pharmaceutical intervention should be given immediately. No, pharmaceutical intervention is immediately needed once the blood pressure is stage 2 or higher. What is that? If the patient is having the blood pressure more than 140 systolic and 90 diastolic, more than that, then it calls for the immediate pharmaceutical intervention. But otherwise, pharmaceutical intervention is not required immediately. We should try our best to give lifestyle modification, reducing the salt, improving the potassium level. If the patient is not the kidney failure or kidney deterioration patient, we should check the hyperkalemia. If we are talking about the old lady, because old lady may be having the hypertension with the kidney dysfunction, so we should check the hyperkalemia. We should check the we should check the serum sodium level also. At the same time, we should cut down the sodium in the food. We should we should ensure that physical activity should also be done, because in old age also it is very much important that some sort of the physical activity should be continued so that the blood pressure should remain under control. So salt correction, good amount of the fruits in the diet if the patient is not having the hyperkalemia or not having the kidney dysfunction. Good physical activity is the key methods for the hypertension correction. They should be applied first, and once they are not working, then we should think about correction medication to be given. In the elevated hypertension, medication is not recommended. Medication should only be given once the cutoff for the hypertension is crossed. Yeah, vitamin D level is not only related with the cholesterol, but multiple diseases in our body. It is associated with the vitamin D deficiency. That includes diabetes, that includes hypertension, and hypertension is more commonly associated with the vitamin D deficiency because it happens in the setting of the kidney dysfunction. We all know that vitamin D formation takes place complete with the help of the kidney. So whenever the kidney is not working appropriate or working in the right manner, then vitamin D deficiency most of the time becomes the reason, and sometimes it becomes the effect also. So in those situations, if it is there, we should correct it, whether it will be simple reason for the hypertension, So I cannot say that if you will do start giving the vitamin D and patient blood pressure would become all right. But definitely it will help in improving the blood pressure correction or improving the hypertension if the patient is having the vitamin D deficiency. So if the patient is having the vitamin D deficiency, we should always correct it. But it is not the remedy for the hypertension, or neither it is a remedy for the dyslipidemia. Although there are certain medications, certain statin preparations are coming up in the market which are together with vitamin D, which are in the combination of the vitamin D. But those preparations should be given in the setting of vitamin D deficiency only. Very good question and very interesting also. And it must be, I'm very happy that this question has been asked because both these things are causing each other. They are the vice versa condition. Hypertension is giving rise to the insomnia. And many a times, insomnia is happening for any reason. It gives rise to the hypertension. For example, if somebody is deprived of the sleep for many reasons, for some death in the family, for some financial crisis, for some workplace crisis, or for some personal relation problems, family problems, divorce, etc., these may give rise to the hypertension to the individual. But at the same time, it has also been seen that if a person is having insomnia, and you check the blood pressure and you find that blood pressure is high, simply give the antihypertensive medication to that, and you will see that his sleep will automatically gets restored. So both the things are causing each other and are associated with each other. So this thing should always be kept in mind and should be treated in the after taking the detailed history and should be treated accordingly. That's why I say that many of the hypertensive patients are caught in the psychiatrist clinic because many insomnia patients are also one of them. Multiple times, hypertension is governed by the lifestyle and life's various phenomena. For example, if you are having some stress in your life for whatever reason, and you got the hypertension and you developed hypertension, and you could control your blood pressure on a medication whatever has been set by the doctor. Suddenly that stress has gone and you are happy now. Happiness is the biggest medicine. So laughter is the biggest pill which can correct the hypertension or any such disease. So in those conditions, many a times it is seen that blood pressure comes down. But it does not mean you should reduce the medication, you should stop the medication. Although blood pressure medication should be reduced, can be reduced if the blood pressure is being maintained less than 110 or less than 70 on blood pressure medication, you try to reduce the medication 25% and see what happens. Once it is going high, which is crossing the boundary of the hypertension, you should come back to the same medication. Otherwise, you can continue with the medication what is being reduced. But it should not be stopped immediately. Whenever we stop the medication, or cut off the medication suddenly, it always have the rebound phenomena, and that rebound phenomena again develops hypertension. Sometimes some people remains watchful for 1 month or 15 days or sometime, then the residual effect of the BP medicines remains there, and people thinks that my blood pressure is corrected because now I am not getting any hypertension. But as and when those medications lose its effectivity, their blood level goes zero, then again blood pressure starts getting rising, and it takes some time to cross the danger line. And whenever it crosses the danger line, you will not come to know that danger line has been crossed. So for any reason, if somebody's blood pressure goes down to the level where he or she needs to stop the medicine, he should be always very much watchful for his or her blood pressure, whether it is not rising again. Because whenever you stop the medicine and blood pressure rises again and you need to start the medicine again, there are two biggest losses. One, for that certain time period, your blood pressure keeps on high. Your all the end organs which are being affected by the hypertension, they are getting deteriorated, they are getting spoiled, may it be kidney, may it be brain, may it be heart, may it be other important organs of the body. Many people start getting the forgetfulness. They start getting the many diseases which may be related to the closure of the small arteries in the brain. Sexual dysfunction is also one of them. And once they start the medicine again, after once they come to know that this thing can happen and they go to the doctor and doctor says, no, you have not stopped the medicine of the blood pressure, again start. Then always remember, once you are stopping the medicine and taking a break for the medicine and starting it again, the second time, the more medicine shall be required as it has been required for the first time. More medicine shall be required to bring you down normal than as it has been in the first time. So why to do this take and why take this much of the risk? Keep continue the medication. Varicose vein is not directly related to the hypertension, but if any person having the varicose vein but hypertension is also there, then it should also always be corrected. We cannot think that obviously that varicose vein is because of the hypertension, but if it is there, it's to be corrected, and both are the separate thing, may not be related with each other, but hypertension should be corrected in any situation.